In this section, you'll learn how to manage an unconscious person who is still breathing. One misstep can let their airway close before emergency help arrives. When you act in the right order, you help keep air moving, reduce the risk of choking, and protect the casualty until paramedics take over. Start with DRS ABCD. Check for danger first so you, the casualty, and bystanders stay safe, then check for response by talking loudly and gently, squeezing the shoulders. If there's no response, send for help. Call 000 and open the airway with head tilt chin lift unless you suspect spinal injury, where you use the gentlest airway opening possible. Next, look, listen, and feel for normal breathing for up to 10 seconds. You're checking for regular breaths, not occasional gasps or uncertain chest movement. If the casualty is breathing normally, ANSCOR recommends turning them onto their side. If they are not breathing normally, begin CPR straight away and follow the resuscitation sequence. To place the casualty into the recovery position, bring the far arm across the chest and place the back of that hand against the cheek closest to you. Then bend the far knee, keep the hand against the cheek and roll the person gently towards you in one controlled movement. Once they're on their side, set the upper leg and hip at about 90 degrees for stability and tilt the head slightly back so the airway stays open. The mouth should face downwards so vomit, blood, or other fluid can drain away instead of collecting at the back of the throat. Don't put anything under the head and don't give food, water, or medication. An unconscious casualty can't protect their own airway. Keep monitoring the casualty the whole time. Watch their breathing, level of response, skin color, and any change that suggests their condition is getting worse. Reassess often, keep them stable, and have an AED brought if available. If breathing stops or you're no longer confident it's normal, start CPR immediately. Common errors include skipping the danger check, leaving the casualty flat on their back, or assuming they're fine because they were breathing a moment ago. Never leave an unconscious person unattended, and never put anything in their mouth. Safe first aid means reassessing again and again until help arrives. In assessment, you'll be marked on doing DRS ABCD in the correct order, checking breathing properly and moving promptly to the recovery position when normal breathing is present. Assessors will also look for ongoing airway control, steady monitoring, and the right decision if the casualty's breathing changes at any point. Now practice the full sequence on a partner or mannequin. Start with your scene check, work through response and breathing, then place the casualty into the recovery position. Keep rehearsing the monitoring phase as well. The goal is to stay calm, use the same safe order every time, and respond without needing prompts. Follow DRS ABCD. Place a breathing, unconscious casualty onto their side, keep the airway open, and continue monitoring until help arrives. If normal breathing stops, start CPR immediately. Keep practicing this sequence until it feels clear, safe, and automatic. CPR procedure: 30 chest compressions, center of the chest, lower half of the sternum, compress approximately 1/3 of the chest depth, about 5 to 6 centimeters, rate of 100-120 compressions per minute. Allow full chest recoil after each compression. 2 rescue breaths, open the airway, pinch the nose closed, seal your mouth over the casualty's mouth. Give 2 breaths, each over about 1 second, watching for the chest to rise. Continue the cycle of 30 compressions, 2 breaths 30 by 2.